Well, I think here we need a top-down and bottom-up approach. I think there must be some government leadership, political will to actually, through either policy or mandates, to actually create an environment which is actually more conducive to actually healthy living. For example, really, anti-smoking campaigns are important because I think smoking amplifies a lot of the risk, and there are a lot of people smoking in Asia. 50% of Chinese men are actually smokers, and I think there's also emerging evidence suggesting that smoking is an independent predictor for diabetes. So I think those are factors that as an individual, and there's so much peer influence. And I think sometimes the government might need to actually put in some kind of legislation to help that. Hong Kong has been quite successful in doing that. I think there has to be a lot of education, in terms of, making people aware that we are living in an obesogenic environment, really encouraging, healthy food intake, doing exercise, and that probably need to start really from childhood. Another very important point is actually protecting women early on, because I think some of the genetic predisposition, or call it programming, might already be laid down at the stage of conception. And these are areas like sort of India, where there's a lot of maternal malnutrition, and the baby comes with low birth weight. These babies are very, very vulnerable because they're going to go through the next 20 years. They go through child obesity, then they will have early onset kind of metabolic syndrome. So I think making a healthcare system, more accessible, so that people have more preventive care, is important, rather than waiting for all these difficult to treat diseases. So I think strengthening the healthcare system, a lot of awareness program, a lot of education. But in terms of preventing some of these the onset of some of these diseases, now as far as people who already got the disease, then I think a more collaborative and team-based approach must be adopted, because these people need tremendous amount of education and support and motivation so that they can gradually change their lifestyle. And that means not just political, personal will. Sometimes they need support, right? They need really people educating them. Sometimes they even need medications to help them, and need feedback as well. So I think currently the healthcare system is designed to really look after acute illnesses, or sometimes episodic illnesses in the GP setting, but they don't have a very good system to actually look after somebody for the rest of their life with a chronic disease.